So good evening, everyone. I believe it's my first time with you guys. So I am Myles Al Arellano, and I'm from Cagayan de Oro City. I graduated in last July last year. I'm from Xavier University College of Nursing. So for today, I'll discuss NP3 ratio numbers 1 to 50 for recalls 9. And if there are any issues about my internet, please inform me sa chat po, ha? Thank you. So, let's start. NP3 ratio recalls 9. Number 1, situation. Nurse James is assigned in the medical surgical ward. He is dealing with a client who has diverticulitis. Number 1, the client diagnosed with diverticulitis is complaining of severe pain in the left lower quadrant and has an oral temperature of 100.6 Fahrenheit. Which intervention should the nurse implement first? A. Notify the healthcare provider. B. Document the findings in the chart. C. Administer an oral antipyretic. Or D. Assess the client's abdomen. What are your answers here? Okay, the answer here is letter D. Assess the client's abdomen. Kasi guys, itong severe pain in left lower quadrant, tapos high temperature, these are classic signs and symptoms of diverticulitis. So there is no need to notify the healthcare provider. Pero, these are, even if these are not, these are just classic symptoms, you still need to assess, because if it is rigid, then it is already indicating peritonitis. This is MP3. Yung oral antipyretic naman, nurses should not administer any medications. So this is diverticulosis and diverticulitis. Guys, I have a question. Lahat ba na nagkaka-diverticulosis ay magkaka-diverticulitis? Yes or no? No, 'di ba? It's not really hindi siya like super connected na if my osis and then my itis. No, because diverticulitis is just another complication of diverticulosis. It could be diverticular bleeding or it could be obstruction, but not always diverticulitis. Kasi nangyayari lang to if there is a fecalit that will enter the diverticulum or the diverticula. So next is ito. You can screenshot this one. These are signs and symptoms of diverticulosis. Patients are usually asymptomatic until they develop a complication. So what may happen is there is a change in bowel pattern or abdominal bloating. And then for diverticulitis naman, you remember pouch. P is pain in abdomen, mainly in the left lower quadrant. O is observed abdominal bloating and blood in stool. U is unrelenting cramping type pain. C is constipation. And H is high temperature. Because left lower quadrant, this is the sigmoid colon. Diyan commonly nangyayari ang diverticulosis. Now we'll proceed to number 2. The nurse is teaching the client diagnosed with diverticulosis. Which instruction should the nurse include in the teaching session? A. Discuss the importance of drinking 1,000 ml of water daily. B. Instruct the client to exercise at least 3 times a week. C. Teach the client about eating a low residue diet. Or D. Explain the need to have daily bowel movements. What's the answer here? The answer is letter D. Explain the need to have daily bowel movements. Yung letter A, guys, at least 3,000 ml dapat, not just 1,000 ml water daily. Tapos yung letter B, it says at least 3 times a week. You should educate them to exercise daily to help prevent constipation. And then yung letter C naman, teach the client about eating a low residue diet. You teach them to eat a high fiber diet. This is NP3, numbers 1 to 50. Next is number 3. The client is admitted to the medical unit with a diagnosis of acute diverticulitis. Which healthcare provider's order should the nurse question? A. Insert an isogastric tube. B. Start an IV with D5W at 125 ml per hour. C. Put the client on a clear liquid diet. Or D. Place the client on bed rest with bathroom privileges. Anong answer niyo dito, guys? Hanap tayo ng mali, di ba? So yes, you're right. Correct answer is letter C. Put the client on a clear liquid diet because we need to put the bowel on total rest. So NPO siya. Yung letter B, IV fluids will help prevent dehydration, especially in clients who are in NPO. And then letter D, the client is in severe pain, so they should be in bed rest. Next is number 4. The nurse is discussing the therapeutic diet for the client diagnosed with diverticulosis. Which meal indicates the client's understanding the client understands the discharge teachings? A. Fried fish, mashed potatoes, and iced tea. B. Ham sandwich, applesauce, and whole milk. C. Chicken salad on whole wheat bread and water. Or D. Lettuce, tomato, and cucumber salad and coffee. And the answer here, guys, is letter C. Chicken salad on whole wheat bread and water. Hindi pwede si A kasi fried food, they increase cholesterol. And they are cholesterol is putting at high risk for diverticulosis. Yung letter B, even if may applesauce, it does not have the peel. Kasi yung sa fruits, nandun sa peel nila yung fiber. Kaya hindi siya yung correct answer. And then yung whole milk is high in fat. Letter D naman, tomato and cucumber, they have those seeds. And for diverticulosis patients, you should avoid seeds because of the possibility na mag-enter sa outpouching yung mga seed. Next, okay, yung sa letter C naman, yung chicken salad, it has vegetables which is high in fiber. Next is number 5. The client is 2 hours post-colonoscopy. Which assessment data warrant immediate intervention? That's immediate intervention by the nurse. A, the client has a soft, non-tender abdomen. B, the client has a loose, watery stool. C, the client has hyperactive bowel sounds. Or D, the client's pulse is 104 and BP is 98/60. And the answer here is letter D. The client's pulse is 104 and BP is 98/60. Guys, one potential complication talaga ng colonoscopy is bowel perforation. So if there are any signs of hypotension, tapos increase pa yung pulse, this should be in immediate intervention na from the nurse. Yung letter A, the abdomen should be soft and non-tender. So this doesn't require any intervention. Yung letter B naman, the client, they had to clean the bowel prior to colonoscopy. So watery stool is expected. Yung letter C naman, hyperactive bowel sounds. Diba, the client was NPO. And then they received bowel preparation before the colonoscopy. So the hyperactive bowel sounds, it might occur. Na-screenshot na ba? Next ko na ha, number 6. The nurse is preparing to administer the initial dose of an aminoglycoside antibiotic to the client diagnosed with acute diverticulitis. Which intervention should the nurse implement? A. Obtain a serum trough level. B. Ask about drug allergies. C. Monitor the peak level, or D. Assess the vital signs. Take note, it says initial dose. Unang dose pa lang. The answer here is letter B. Ask about drug allergies. Kasi, kahit anong medication pa yan, guys, before nyo ibibigay, ask them about drug allergies. Especially for antibiotics na notorious for allergic reactions. Diba? When we give IV antibiotics, before giving that, skin test muna tayo, diba, intradermally, to check if there is any allergy. Yung trough level and peak, before anything else, yung trough level, guys, yan yung concentration ng drug in the blood immediately before the next dose is administered. So, yung trough and then yung peak level, kukunin yan siya after the client has at least 3 or 4 doses na na-receive niya, not on the initial dose. Yung sa vital signs naman, guys, there is no vital sign that restricts or prevents the nurse from administering an antibiotic. Not like beta blockers that you need to check the BP or the heart rate, ganun. Next is number 7. The client is diagnosed with acute diverticulitis and is complaining of severe abdominal pain. On assessment, the nurse finds a hard, rigid abdomen and temperature of 102 Fahrenheit. This is 38.9. Which intervention should the nurse implement? A. Notify the healthcare provider. B. Prepare to administer Fleet's enema. C. Administer an antipyretic suppository. Or D. Continue to monitor the client closely. And the answer here, your answers here, guys, it's letter A. Tama, letter A. Notify the healthcare provider. Guys, when it says severe abdominal pain and hard rigid abdomen, this is already a sign of peritonitis and it is life-threatening. This is opposite sa letter D. So test-taking strategies, 2 opposite choices. One of them is really the answer there. Yung letter B and the letter C, they don't help in this type of life-threatening na condition. Next is number 8. The nurse is working in an outpatient clinic. Which client is most likely to have a diagnosis of diverticulosis? So A, 60-year-old male with sedentary lifestyle. B, 72-year-old female with multiple childbirths. C, 63-year-old female with hemorrhoids. Or D, a 40-year-old male with family history of diverticulosis. The answer here, what are your answer here, guys? Answer here is C. It's C, female with hemorrhoids. So, bakit hindi A? Usually kasi, may nag-answer ng A, mayroon din D. Yung sa A, guys, yung sedentary lifestyle, it may contribute to obesity, hypertension, or heart disease, but not usually diverticulosis. Yung multiple childbirths, totally unrelated yon. Yung letter D naman, even if there is family history of diverticulosis, as long as that 40-year-old male has a high-fiber diet and prevents constipation, like exercises daily, increase fluid intake, it will reduce the risk or the chance of developing diverticulosis. Tapos yung hemorrhoids is a constipation kasi it increases the intraluminal pressure in the the hemorrhoid, it would indicate the client has chronic constipation. Okay, so constipated nga siya. If there is chronic constipation, then it would lead to diverticulosis. Next is number 9. The client with acute diverticulitis has a nasogastric tube draining green liquid bile. Which intervention should the nurse implement? A. Document the findings as normal. B. Assess the client's bowel sounds. C. Determine the client's last bowel movement. Or D. Insert the NG tube at least 2 more inches. What are your answers here? Intervention that the nurse should implement. The answer here is letter A. It's just normal. Kasi a green vial, it contains hydrochloric acid and should be draining from the NG tube. So the nurse should not take any action. Yung letter B, walang reason for the nurse to assess the client's bowel sounds. Kasi the drainage is normal. Yung letter C naman, yung last bowel movement ni client, it would not affect the NG drainage. And then number 4, letter D, yung bile draining from the NG tube, it already indicates that it is in the stomach. And there is no need to advance the tube further. Next is number 10. The nurse is teaching a class on diverticulosis. Which intervention should the nurse discuss when teaching ways to prevent an acute exacerbation of diverticulosis? Select all that apply. A. Eat a high-fiber diet. B. Decrease fluid intake. C. Walk 30 minutes a day. Or D. Take an antacid every 2 hours. And the answer here is letters A and C. Yung high-fiber diet and then walk 30 minutes a day because it's high-fiber and exercise. You will increase and not decrease fluid para it will keep the stool soft. Tapos yung antacid every 2 hours, these are used to neutralize hydrochloric acid in the stomach. There is no, it doesn't help in any way sa diverticulitis. Number 11, a new situation. Nurse Tal is a highly experienced med-surg nurse. Her patient that needs her utmost care at the moment is diagnosed with liver failure. Number 11, the client has had a liver biopsy. Which post-procedure intervention should the nurse implement? A. Instruct the client to void immediately. B. Keep the client NPO for 8 hours. C. Place the client on the right side. Or D. Monitor blood urine nitrogen and creatinine level. And the answer here is letter C. Place the client on the right side. Kasi, since he has had a liver biopsy, direct pressure is applied to the site, yes. And then, it is placed on the right side to maintain site pressure. Yung sa letter A, instruct the client to void immediately. Yung emptying of the bladder, it is immediately prior to the liver biopsy and not after. Tapos, NPO for 8 hours, not needed naman kasi yung food, they are usually withheld, food and fluids, usually withheld with 2 hours after the biopsy. And then after that, the client can resume the usual diet. Tapos yung BUN and creatinine, this is for the kidney function. Next is number 12. The client diagnosed with end-stage liver failure is admitted with hepatic encephalopathy. Which dietary restriction should be implemented by the nurse to address this complication? A. Sodium intake to 2 grams per day. B. Limit oral fluids to 1,500 ml per day. C. Decrease the daily fat intake. Or D. Reduce protein intake to 60 to 80 grams per day. The answer here is letter D. Reduce protein intake to 60 to 80 grams per day. Tama, Tosh. That's right, because ammonia is a byproduct of protein metabolism and it contributes to hepatic encephalopathy. Ammonia talaga yung problem dito, guys, sa hepatic encephalopathy. So if you reduce protein intake, it should decrease ammonia levels. Kasi hindi siya na metabolize into urea eh. Kasi damage na yung liver. Yung restrict sodium intake to 2 grams per day, this is to reduce ascites and generalized edema, not the hepatic ense. And then yung limit oral fluids to 1.5 ml per day, wag mo siyang fluids are calculated based on diuretic therapy, urine output, ganun. It doesn't usually affect hepatic encephalopathy. Tapos, yung letter C naman, moderate fat intake, it promotes healing. Next is number 13. The client is diagnosed with end-stage renal failure and ascites and is scheduled for paracentesis. Which client teaching should the nurse discuss with the client? A. Explain the procedure will be done in the operating room. B. Instruct the client a Foley catheter will have to be inserted. C. Tell the client vital signs will be taken frequently after the procedure. Or D. Provide instructions on holding the breath when the HCP inserts the catheter. And the answer here, guys, is it's letter C. Tell the client the vital signs will be taken frequently after the procedure. Kasi the client is at risk for hypovolemia. So vital signs will be assessed to frequently monitor. Yung letter A, the procedure is done in the client's room. And then the client is seated either on the side of the bed or the chair. Tapos yung letter B, the client should empty the bladder prior to the procedure. No need for Foley catheter to be inserted. And then yung letter D naman, the client, they don't have to hold their breath when the catheter is inserted into the peritoneum. Next is number 14. The client diagnosed with liver failure is experiencing pruritus secondary to severe jaundice. Which action by the student nurse warrants intervention by the nurse? A. The student nurse is assisting the client to take a hot, soapy shower. B. The student nurse applies an emollient to the client's legs and back. C. The student nurse puts mittens on both hands of the client. Or D. The student nurse pats the client's skin dry with a clean towel. And the answer here is letter A. The student nurse is assisting the client to take a hot, soapy shower. Yung hot water and the hot water increases pruritus, tapos yung soap will cause dry skin which will also increase pruritus. So yan yung mali. Yung emollient lotion, guys, it will help prevent dry skin. Yung letter C naman, puts mittens on both hands of the... It helps prevent scratching and prevent skin breakdown. Tapos yung letter D naman, the student nurse pats the client's skin. It's correct. What's wrong is rubbing the client's skin dry. Next is number 15. The nurse identifies the client problem, excess fluid volume for the client in liver failure. Which short-term goal would be most appropriate for this problem? A. The client will not gain more than 2 kilograms a day. B. The client will have no increase in abdominal girth. C. The client's vital signs will remain within normal limits. Or D. The client will receive a low-sodium diet. And the answer here is letter B. The client will have no increase in abdominal girth. You're correct. Because excess fluid volume could be due to portal hypertension. So if there is no increase, in abdominal girth would be an appropriate short-term goal na related to excess fluid volume. Yung letter A, guys, the client will not gain more than 2 kilograms per day. Yung limit mo na 2 kilograms per day, that's already for almost or more than 4 pounds actually. So this is already severe fluid retention and it is not an appropriate goal. Yung letter C naman, vital signs are appropriate to monitor, oo, pero hindi siya nagbibigay ng specific information about excess fluid volume. About fluid volume status rather. Tapos yung letter D, will receive a low sodium diet. Kahit sabihan natin, kahit instruct natin yan, guys, we are really not sure if they are complying religiously to the instruction of low sodium diet. So the correct answer is letter B. Next is number 16. The client in end-stage liver failure has vitamin K deficiency. Which intervention should the nurse implement? Select all that apply. A. Avoid rectal temperatures. B. Use only a soft toothbrush. C. Monitor the platelet count. D. Use small gauge needles. Or E. Assess for asterixis. Your answers here, guys. It is letters A, B, C, and D. Kasi yung vitamin K deficiency, this is causing impaired coagulation. So hanap tayo na related sa bleeding dito. Rectal thermometer should be avoided to prevent bleeding. Yung soft toothbrush, it helps to prevent bleeding sa gums. Monitoring of platelet count naman, it assesses the coagulation status. And then yung small gauge needle, guys, injection should be avoided if at all possible. Pero there are times that it is absolutely necessary, so the nurse should use small gauge needles. Okay? Yung asterixis naman, this is flapping tremor, tapos related siya sa elevated ammonia levels. Next is number 17. Na-screenshot na, guys? Number 17. Which gastrointestinal assessment data should the nurse expect to find when assessing the client in end-stage liver failure? A. Hypoalbuminemia and muscle wasting. B. Oligomenorrhea and decreased body hair. C. Clay-colored stools and hemorrhoids. Or D. Dyspnea and caput medusae. What are your answers here? Gastrointestinal. Answer is letter C. Correct. Letter C. Clay-colored stools and hemorrhoids. Kasi, these are gastrointestinal effects of liver failure. Yung hypoalbuminemia and muscle wasting, this is metabolic. Okay? Oligomenorrhea, reproductive. Yung decreased body hair is integumentary. Yung dyspnea is respiratory, and caput medusae, this is dilated veins around the umbilicus. This is an integumentary effect, even though it happens in the abdomen. This is NP3 of Recalls 9, number 1 to 50. Number 18. Which assessment question is priority for the nurse to ask the client diagnosed with end-stage liver failure secondary to alcoholic cirrhosis? A. How many years have you been drinking alcohol? B. Have you completed an advance directive? C. When did you have your last alcoholic drink? Or D. What food did you eat at your last meal? Next, the answer is, answer is letter C. When did you have your last alcoholic drink? This is to know when this is to determine when the client had the last take and if the client will already experience delirium tremens. This is like the worst withdrawal already. Yung letter A, guys, how many years have you been drinking alcohol? It doesn't matter anymore because given na yan, alcoholic cirrhosis na yung diagnosis, it is given that he had years of drinking. Yung letter B, have you completed an advance directive? This is important but not a priority. And then yung letter D naman, what foods did you eat your last meal? Not a typical question to ask alcoholic cirrhosis unless may malnourished na state. Next is number 19. The client has end-stage liver failure secondary to alcoholic cirrhosis. Which complication indicates the client is at risk for developing hepatic encephalopathy? A. Gastrointestinal bleeding. B. Hypoalbuminemia. C. Splenomegaly. Or D. Hyperaldosteronism. What are your answers here, guys? The answer here is tama. Letter A. Gastrointestinal bleeding. Kasi the blood is being digested as protein. So increased protein, increased ammonia levels, increase the risk of developing hepatic encephalopathy. Yung hypoalbuminemia, this causes the client to develop ascites. Yung hyperaldosteronism naman, it causes sodium and water retention. Also the development of ascites and generalized edema. Yung enlarged spleen, it increases the rate at which the RBCs, WBCs, and platelets are being destroyed. So, ang mangyayari dito is anemia, leukopenia, and thrombocytopenia, not hepatic encephalopathy. Next is number 20. The client is diagnosed with end-stage liver failure. The client asks the nurse, why is my doctor decreasing the doses of my medication? Which statement is the nurse's best response? A, you are worried because your doctor has decreased the dosage. B, you really should ask your doctor. I'm sure there is a good reason. C, you may have an overdose of the medications because your liver is damaged. Or D, the half-life of the medications is altered because the liver is damaged. Answer here is letter C. You may have an overdose of the medications because your liver is damaged. Letter A, you are worried because, guys, this is med surg. This is not like, no, don't restate. Don't tell them that you're worried because your doctor has decreased the doses. Give them a factual information rather than the verbalization of feelings. No, it's not important. Yung Theracom, guys, lalabas siya sa lahat ng NPs. Okay? Pero you should really answer it in a way that it hits the situation right. Not just because it sounds the correct answer, ganun. You really should read the situation well. Letter B, you really should ask your doctor. I'm sure there is a good reason. Masasagot natin to. We can just say she will have an overdose. Ganun. D, the half-life of the medications is altered because the liver is damaged. This is a medical explanation and not used for a layperson. Number 21. Situation. Pancreatitis is one of the common diseases encountered in med-surg ward. The nurses can expect to care for patients with pancreatitis in inpatient settings. Excuse me. 21. The client is admitted to the medical department with the diagnosis of rule-out acute pancreatitis. Which laboratory value should the nurse monitor to confirm this diagnosis? A. Creatinine and BUN. B. Troponin and CKMB. C. Serum amylase and lipase. Or D. Serum bilirubin and calcium. The answer here is letter C. Serum amylase and lipase. So, yung serum amylase, guys, I'll type here. Wait, I'll read it first. Yung serum amylase, it increases within 2 to 12 hours at the onset of acute pancreatitis. Tapos yung increase niya times 2 or times 3 than normal. Tapos babalik siya in 3 to 4 days. Yung lipase naman, it elevates and remains elevated for 1 to 2 weeks. Okay? I'll put it here. Chat ko na lang. Kasi naka-presenter view na ako eh. Ito. Yung letter A, it's more on the kidney fail. This is for kidney failure. Tapos yung letter B for myocardial infarction. Tapos yung letter D, there is a research that says bilirubin may be elevated as a result sa compression ng common duct. Tapos hypocalcemia raw may also happen and develops in 25% of clients with acute pancreatitis. Pero hindi siya yung confirmatory diagnosis. Next is number 22. Which client problem has priority for the client diagnosed with acute pancreatitis? A. Risk for fluid volume deficit. B. Alteration in comfort. C. Imbalanced nutrition less than body requirements. Or D. Knowledge deficit. It says acute pancreatitis, so this is painful, guys. Correct answer here is letter B. Alteration in comfort. There is autodigestion of the pancreas. This results in severe epigastric pain. Ang nangyayari pa dito, guys, there is nausea, vomiting, abdominal tenderness, and muscle guarding. Yung letter A, risk for fluid volume deficit. The client will be NPO to help decrease pain, but it is not the priority problem kasi bibigyan siya ng IV fluids. So, not really correct yung A. Yung letter C naman, it's a possible client problem pero not a priority compared sa severe epigastric pain. And letter D, knowledge deficit, always a client problem naman, pero not a priority over pain. Next is number 23. The nurse is preparing to administer AM medications to clients. Which medication should the nurse question before administering? A. Pancreatic enzymes to the client who has finished breakfast. B. The pain medication, morphine, to the client who has respiratory rate of 20. C. The loop diuretic to the client who has a serum potassium level of 3.9 milliequivalent per liter. Or D. The beta blocker to the client who has an apical pulse of 68 beats per minute. Nurse question, so we're looking for a wrong answer. The answer here is letter A. Pancreatic enzymes to the client who has finished breakfast. Yung pancreatic enzymes, guys, it must be administered with meals or like immediately before meals. Same vibe. Same vibe siya sa short-acting insulin na dapat pag-take mo, andun na yung food mo in front of you and you're gonna eat it immediately. Because it enhances the digestion of starches and fats in the GI tract. Yung letter B, morphine, okay naman yung respiratory rate 20. So, not a problem. Letter C, the normal potassium is 3.5 to 5. So, loop diuretic is not a problem. Yung beta blocker, 68 beats per minute, still normal. So, the beta blocker is not a problem. Number 24. The client is diagnosed with acute pancreatitis. Which healthcare provider's admitting order should the nurse question? A. Bed rest with bathroom privileges. B. Initiate IV therapy of D5W at 125 ml per hour. C. Weigh the client daily. Or D. Low-fat, low-carbohydrate diet. Answer here is, it's letter D. Low-fat, low-carb diet. Because the client will be NPO. Because, guys, the client is in NPO pag pancreatitis kasi we're aiming for the decreased stimulation of the pancreatic enzymes. So, resulting in decreased autodigestion of the pancreas, therefore decreasing the pain. Yung letter A, bed rest, it will help with the pain. So this should not be questioned. Letter B, since the client is NPO, we should give IV fluids. And then yung letter C naman, short-term weight gain changes reflect fluid balance because the client will be NPO and receiving IV fluids. Pwede pa ulit sa 23. Bakit letter A yung sagot? Okay. This is wrong kasi ang sabi dito, pancreatic enzymes to the client who has finished breakfast. Like, wag kang mag-administer ng pancreatic enzymes after breakfast. They should be given before meals. Like, immediately before meals. Okay? Hindi rin pwede na like, nagbigay ka and then after 30 minutes or after an hour pa siya kakain. No. Like, immediately prior talaga. Next is number 25. The nurse is completing discharge teaching to the client diagnosed with acute pancreatitis. Which instruction should the nurse discuss with the client? A. Instruct the client to decrease alcohol intake. B. Explain the need to avoid all stress. C. Discuss the importance of stopping smoking. Or D. Teach the correct way to take pancreatic enzymes. Discharge teaching. So this is letter C. Discuss the importance of stopping smoking. Guys, sa almost lahat ng sakit, smoking is really the problem. So, yung letter C kasi, smoking, it stimulates the pancreas to release pancreatic enzymes and should be stopped. Letter A, instruct the client to decrease alcohol intake. It must be avoided entirely. Yung sinasabi na hindi na talaga ako iinom, dapat legit dito. It might not be legit to some of other people who say na hindi na talaga ako iinom, but for the client who was diagnosed with acute pancreatitis, they should really avoid it entirely. Yung letter B, explain the need to avoid all stress. This is not really, stress will always happen eh. Kahit anong avoid natin, it will really happen. So, it is unrealistic. Letter D naman, correct way to take pancreatic enzymes. This is for chronic pancreatitis, not acute. Next is number 20. Guys, we will have a short break. Only 5 minutes if it's okay para mas easier, mas madali tayong ma-finish. And then I'll continue with number 26 if that's okay with you. So balik tayo 8:46. Thank you. So guys, we're back. Please tell your friends who disconnected na mag-start na ulit tayo. So we're gonna continue. Number 26. The male client diagnosed with chronic pancreatitis calls and reports to the clinic nurse he has been having a lot of gas along with frothy and very foul-smelling stools. Which intervention should the nurse implement? A. Explain that this is common for chronic pancreatitis. B. Ask the client to bring in a stool specimen to the clinic. C. Arrange an appointment with the HCP for today. Or D. Discuss the need to decrease fat in the diet so this won't happen. Chronic pancreatitis. Guys, there is a description of his stool. Anong tawag sa stool nito? Frothy and very foul smelling. It's steatorrhea. Okay? And this is already dangerous. So the answer here is letter C. Arrange an appointment with HCP for today. This is caused by a decrease in pancreatic enzyme secretion. So there is impaired digestion and possibly an increase or the severity of the pancreatitis. Yung letter A, any change in stool is cause for concern. So don't just say this is common. Yung letter B naman, ask the client to bring in a stool specimen. It's not needed anymore kasi na-describe na nga niya. And then we already identified it as steatorrhea. And then yung letter D, discuss the need to decrease the fat in the diet. This will not help stop this type of stool. Okay? So, next is number 27. The nurse is discussing complications of chronic pancreatitis with a client diagnosed with the disease. Which complication should the nurse discuss with the client? A. Diabetes insipidus. B. Crohn's disease. C. Narcotic addiction. Or D. Peritonitis. The answer here is letter... Ang cute ni direct. Guys, it's okay. Don't need to send it a direct message. This is chronic pancreatitis, guys, no? So this is very painful. And what do we give for people who are always in pain? It's narcotics, diba? So the answer is letter C, narcotic addiction. This is, they require narcotics na for relief eh. Yung number 1, they are at risk for diabetes mellitus, not DI. Yung letter B naman, this is an inflammatory disorder sa of the lining of the gastrointestinal system, especially the terminal ileum. So not a complication of chronic pancreatitis. Yung peritonitis naman, this is not a common complication of chronic pancreatitis. Next is number 28. The client is in immediate post-procedure endoscopic retrograde cholangiopancreatogram. Which intervention should the nurse implement? A. Assess for rectal bleeding. B. Increase fluid intake. C. Assess gag reflex. Or D. Keep in supine position. Immediate post-procedure. The answer here is letter C. Tama kayo. Assess gag reflex. Kasi, the gag reflex will be suppressed due to the local anesthesia. So it must be assessed prior to allowing the client to resume eating or drinking to avoid aspiration. Yung letter A, the scope is placed down the client's mouth. So there's no need to assess for rectal bleeding. Letter B naman, you should withhold fluids, food and fluid until the gag reflex has returned. And then letter D, keep in supine position. The client should be in a semi-Fowler's or side-lying position to prevent aspiration. Next is number 29. The client diagnosed with acute pancreatitis is in pain. Which position should the nurse assist the client to assume to help decrease the pain? A. Recommend lying in the prone position with legs extended. B. Maintain a tripod position over the bedside table. C. Place in side-lying position with knees flexed. Or D. Encourage a supine position with a pillow under the knees. The answer here is letter C. Help decrease the pain. Letter C. This fetal position, this decreases pain caused by the stretching of the peritoneum. So, since naka-knees flex and then sideline position, hindi naka-stretch yung peritoneum, which is the cause of the pain. Lying and in your stomach will not help decrease the pain. Yung tripod position naman, this is for COPD patients to help lung expansion. And then yung letter D encourages supine position. Laying supine, it causes the peritoneum to stretch, which increases the pain. Okay? Number 30. The client with an acute exacerbation of chronic pancreatitis has a nasogastric tube. Which intervention should the nurse implement? Select all that apply. A. Monitor the client's bowel sounds. B. Monitor the client's food intake. C. Assess the client's intravenous site. D. Provide oral and nasal care. Or E. Monitor the client's blood glucose. And the answer here is ACDE. It's ACDE. Yung letter E, monitor the client's bowel sounds. This indicates, kasi yung return of the bowel sounds, it indicates the return of peristalsis. And the nasogastric suction is usually discontinued within 24 to 48 hours. Yung letter C naman, the nurse should assess for signs. Kasi tinanong to kanina, like, bakit kasama siya? Kasi guys, di ba, when the patient is in NGT, you give IV fluids. So you should also assess for signs of infection or infiltration yung kanilang IV. Letter D naman, provide oral and nasal care to decrease the risk of mucous membrane irritation and breakdown. And then yung letter E, chronic pancreatitis can develop DM. So you should monitor. Okay? Number 31. Situation. Patients with adrenal disorders deal with a lot of symptoms. Proper management and intervention is needed to achieve better health outcomes. So 31, the nurse is admitting a client diagnosed with primary adrenal cortex insufficiency or Addison's disease. Which clinical manifestation should the nurse expect to assess? So adrenal disorders, for sure, I know for sure that you guys already know the difference between Addison's or Cushing's. So letter A, is this Addison's or Cushing's? Yung letter A, moon face, buffalo hump, and hyperglycemia. This is Cushing's. Yung letter B, hirsutism, fever, and irritability. Cushing's or Addison's? It's also Cushing's. Letter C, Cushing's or Addison's? Bronze pigmentation, hypotension, and anorexia. This is Addison's. Yung letter D naman, tachycardia, bulging eyes, and goiter, is this is more on the thyroid. So is this hyperthyroid or hypothyroid? This is hyperthyroid. Very good. So the answer here is letter C, bronze pigmentation, hypotension, and anorexia. Okay? Yan yung nangyayari sa Addison. Next is number 32. The nurse is planning the care of a client diagnosed with Addison's disease. Which intervention should be included? A. Administer steroid medications. B. Place the client on fluid restriction. C. Provide frequent stimulation. Or D. Consult physical therapy for gait training. Isa-isahin natin ha. Addison's disease. Okay, so the answer is your answers are letter A. So if the answer is letter A, bakit hindi letter B? Why shouldn't we put the client in fluid restriction? This is because mag-dry lalo. Yes. this will exacerbate a crisis if you will put them on fluid restriction. Yung letter C naman, provide frequent stimulation. Okay, I'll change na ha. Ito. Yung letter A, yan yung tama. Kasi, there is adrenal gland hypofunction. It should be replaced by steroid medications. Yung letter C, the client will require a quiet, calm, and relaxed atmosphere. Okay? The client will require quiet, calm, and relaxed atmosphere. And then letter D, consult physical therapy for gait training. I have a question. Does this person have a stoop posture from fatigue? Yes or no? Stoop posture due to fatigue. Yes or no? Sa Addison's. There, okay. No, there's meron silang stoop posture. This is due to fatigue. Pero, yung gait training, hindi siya need. Hindi siya need, yung gait training. Okay? Next is number 33. The client is admitted to rule out Cushing syndrome. Which laboratory test should the nurse anticipate being ordered? Rule out Cushing syndrome. A. Plasma drug levels of quinidine, digoxin, and hydralazine. B. Plasma levels of ACTH and cortisol. C. A 24-hour urine for metanephrine and catecholamine. Or D, spot urine for creatinine and white blood cells? And the answer here is, it's letter B. Kasi, yung adrenal gland, they secrete cortisol. And then yung pituitary gland, they secrete the adrenocorticotropic hormone, which is used by the body to stimulate the production of cortisol. Yung letter A, yung quinidine, digoxin, and hydralazine, according to sources and research, they interfere with the adrenal gland secretion. Tapos, it will cause hypofunction, lowered or decreased function. Cushing's has an increased or hyperfunction of the adrenal gland. So, crush out na tong A. Yung letter C naman, yung metanephrine and catecholamine, para to sa pheochromocytoma. Again, what is pheochromocytoma? Tumor in saan to siya nakikita na tumor? Adrenal gland. Cortex or medulla? Adrenal cortex. Adrenal cortex or adrenal medulla? Pati ako guys wait lang. Na-confuse ako. Di ba? Medulla. Oh my God. Sorry guys, late night. Yan kasi guys, yung pheochromocytoma, palagi ko siyang na-forget during my boards. Kaya hanggang ngayon, sa medulla siya. Yun pala siya. I always remember it. Pheochromocytoma. Para siyang ang taas niya. So, mas important. And then, yung important is nasa middle. That's how I remembered it before. May lumabas ba pheochromocytoma? I think no. Sorry, na-confuse ako ulit. Oh my God, PTSD. May PTSD talaga ako dito. Kasi guys, yung pheochromocytoma, laging lumalabas sa recalls namin. So, it gives me the scares. Yung letter D naman, spot urine for creatinine and white blood cells. Yung spot urinalysis and white blood cell count, this will not provide information on adrenal gland functions. When ka po nag-take, ma'am? Last November 2022. May ganitong level po ba natin naman? Guys, there is my question sa boards na magiging happy ka. Pero meron ding questions na like hindi mo nabasa sa 5 or more months na review mo. Like you really just can't say napapasa ka after. If you can say napapasa ka after the boards, then good for you. Pero for me, I really didn't have the confidence to say that. No joke. Ilang months ka po nag-review? I started August. August yun sa top rank. August, September, October, November. 3 months. Pero they gave a pre-intensive starting June or July. Pero hindi ako nakinig. So, I'm a face-to-face kid. So, yun. August start. Next is number 34. The nurse is performing discharge teaching for a client diagnosed with Cushing's disease. Which statement by the client demonstrates an understanding of the instructions? A, I will be sure to notify my healthcare provider if I start to run a fever. B, before I stop taking the prednisone, I will be taught how to taper it off. C, if I get weak and shaky, I need to eat some hard candy or drink some juice. Or D, it is fine if I continue to participate in weekend games or tackle football. The answer here is, it's letter A. Very good. Kasi, it predisposes the client to develop infections because of the immunosuppressive nature. Okay? Wag mo na siya bigyan ng prednisone kasi ang taas na nga ng kanyang cortisol. And then yung letter C, these are signs of hypoglycemia. Tapos yung sa Cushing's, they have hyperglycemia. Diba? Increased salt, sex, sugar. So, hypoglycemia is not expected. Letter D naman, they are predisposed to fractures, so contact sports should be avoided. Number 35. The charge nurse of an intensive care unit is making assignments for the night shift. Which client should be assigned to the most experienced intensive care nurse? A, the client diagnosed with respiratory failure who is on a ventilator and requires frequent sedation. B, the client diagnosed with lung cancer and iatrogenic Cushing's disease with ABGs of pH 7.35, PaO2 of 88, PCO2 of 44, and HCO3 of 22. C, the client diagnosed with Addison's disease who is lethargic and has a BP of 80/45, pulse rate of 124, and RR of 28. Or D, the client diagnosed with hyperthyroidism who has undergone a thyroidectomy 2 days ago and has a negative Trousseau sign. The answer here, may nag-aaway-away pa sa class ko before because of this one. Answer is letter C. Client diagnosed with Addison's disease who is lethargic and has a BP of 80/45, P of 124, and RR 128. This may be experiencing a Addisonian crisis already, a potentially life-threatening condition. Others will answer letter A, kasi respiratory failure na daw and on a ventilator and requires frequent sedation. Guys, this can be taken care by any ICU nurse. Again, just to remind you, ICU nurse, di pwede basta-basta nurse lang i-assign dun. Dapat they have the skills, the knowledge already. So they can take care, anyone can take care of letter A. But yung letter C, this is a Addisonian crisis. They need someone who is really experienced. Okay? Yung letter D, negative sign, so nothing to worry about. Yung letter B, yung blood gases niya is within normal limits. Guys, another tip, dapat master your ABGs. Kasi parang bonus na siya, guys, if lalabas sa exam. You'd be so happy because you just have to you just have to make sure that it's in the range or wala. Tapos may metabolic acidosis, metabolic alkalosis. Para kang nag-puzzle lang if alam mo na yan. Number 36. My ABG, I think, oo. 1 or 2 items. Basta may times na nakasmile ako, guys. So, sobrang happy ko na, may lumabas na ganito. But not all the time. Yung NP3, guys, walang happiness, I swear. I think you've heard of that already. Na-share na ba sa inyo? Sa past lecturers? Na NP3, as in, very difficult sa NP3 namin. November 2022, PNLE. Yes, NP3 and NP4. Guys, imagine, first day, NP1, NP2, NP3. Diba? Last period, last subject yung NP3. So, pagod ka na, diba? Nag-all out ka na sa NP1 and NP2. So, another all out sa NP3. Ang hirap, ang init. So, yun. Kahit po sa recalls, NP3 po ako nahihirapan. Ibang hirap dun, guys. I swear. Ibang hirap talaga. Like, my my super smart kami na batchmate, like, she just knows that she will pass. Guys, after the first day, after NP3, sabi talaga niya, baka makonditional siya. Ganyan kahirap yung NP3. Parang pre-board 1, guys, yung pre-board 1 kasi, para siyang pang med student. Ganun na vibe. Pero yung NP3, masasagutan ng nurse, pero sobrang analysis. Like to the darkest, deepest trenches of the world na analysis. Oh, wait. Next muna. Chika tayo if may time pa after. Number 36, the nurse writes a problem of altered body image for 34-year-old client diagnosed with Cushing's disease. Which intervention should be implemented? A, monitor blood glucose levels prior to meals and at bedtime. B, perform head-to-toe assessment on the client every shift. C, use therapeutic communication to allow the client to discuss feelings. Or D, assess bowel sounds and temperature every 4 hours. Altered body image, basta altered body image, guys, it really sounds like it's really leaning on psych rather than physiological. So the answer is letter C. Use therapeutic communication to allow the client to discuss feelings. Sorry. Kasi yung blood glucose naman, it doesn't address the problem of altered body image. Yung head-to-toe assessment naman, physiological. And then yung letter D, physical symptoms, yung bowel sounds and temperature. Another thing, Theracom, I think nasabi ko na, basta Theracom will be in all NPs. But always read the situation. Para malaman mo kung ano talaga you're right. Kasi ang nakaka-confuse sa Theracom nung boards is everything is right. Like, you can say all of them. Like, wala kang ma-offend na pasyente if you say letter A, letter B, letter C, letter D. But ano yung nakaka-hit sa situation na yun? Yun dapat yung answer mo. Next is number 37. The client diagnosed with Addison's disease is admitted to the emergency department after a day at the lake. The client is lethargic, forgetful, and weak. Which intervention should the nurse implement? A, start an IV with an 18-gauge needle and infuse NS rapidly. B, have the client wait in the waiting room until a bed is available. C, obtain a permit for the client to receive blood transfusion. Or D, collect urinalysis and blood samples for CBC and calcium level. And the answer here, what are your answer here, guys? The answer here is letter A. Start an IV with 18 gauge needle and infuse NS rapidly. Baka nag-a-Addisonian crisis na to kasi after day at the lake, ang init niyan. There might be dehydration already. So, rapid IV fluid replacement is necessary. Pag pinawait nyo yan, guys, mamamatay yan. Magkukoma, mamamatay. Huwag nyo ipawait yan. Dapat may IV fluids. Letter C, blood transfusion, hindi siya appropriate for this client. And then yung lab specimens, also not a priority. Tapos hindi naman problem yung calcium sa Addison's disease. Next is number 38. The nurse manager of a medical surgical unit is asked to determine if the unit should adopt a new care delivery system. Which behavior is an example of autocratic style of leadership? A. Call a meeting and educate the staff on the new delivery system being used. B. Organize a committee to investigate the various types of delivery systems. C. Wait until another unit has implemented the new system and see if it works out. Or D. Discuss with the nursing staff if a new delivery system should be adopted. What are your answers here? Guys, lalabasin. Ang daming lumabas na ganito sa boards. Actually, basta Palmer, lalabas sa lahat ng NPs. Letter A. Call a meeting and educate the staff on the new delivery system being used. Basta autocratic style, yung person, yung leader, they make the decision without consulting anyone else. Not like letter B. See, they organize a committee, discuss with the nursing staff. That's the democratic. Yung letter C is laissez-faire. Next is number 13. Si attorney pa ba? Attorney Kapili ang Palmer niyo. Siya pa nagdi-discuss. Yes. Diba? Such girl, I love her so much. Ang laking tulong niya, promise. Number 39. The client diagnosed with Cushing's disease has undergone a unilateral adrenalectomy. Which discharge instruction should the nurse discuss with the client? A. Instruct the client to take glucocorticoid and mineralocorticoid medications as prescribed. B. Teach the client regarding sexual functioning and androgen replacement therapy. C. Explain the signs and symptoms of infection and when to call the healthcare provider. Or D. Demonstrate turn, cough, and deep breathing exercises that the client should perform every 2 hours. What are your answers here? Hindi ko tulog na yung iba. Guys, carry. Hanggang number 50 lang tayo. Carry nyo to. Answer is letter C. Explain the signs and symptoms of infection and when to call the healthcare provider. Again, Cushing syndrome, it has an immunosuppressive nature. Yung letter A, oops, wait. Lobat muna. Balik muna ako, guys. I'm sorry. Yung letter A, unilateral adrenalectomy results in one adrenal gland is still functioning. So no need for hormone replacement. Yung letter B naman, the client can have normal physiologic functioning, including sexual functioning, with the remaining gland. I think naglag. Naglag, guys. Guys, lag ba ako? Or, okay. Thank you. Kasi sabi, your internet is unstable. Okay. Thank you. Letter D, turning and coughing. This is taught prior to surgery, not during discharge. Okay. So, number 40. Situation. Nurse Jericho is doing rounds to patients in the medical surgical ward. 40, the client is diagnosed with hypothyroidism. Which signs and symptoms should the nurse expect the client to exhibit? A. Complaints of extreme fatigue and hair loss. B. Exophthalmos and complaints of nervousness. C. Complaints of profuse sweating and flushed skin. Or D. Tetany and complaints of stiffness of the hands. Hypothyroidism, isa-isahin muna natin. Letter A, nag-utan concepts na ba kayo? May nag-icons dito or wala? Okay, diba? Low, slow, and dry except menses. Letter A, is this high or low? Letter A, is this high or low? This is low. Letter B, is this high or low? Okay. Letter C, high or low? High siya, okay. And letter D, high or low? Okay, high din. So, the answer is letter A. Complaints of extreme fatigue and hair loss. A decrease in thyroid hormone causes decreased metabolism, which leads to fatigue and hair loss. So, yun siya. Next is number 41. The nurse identifies the client problem, risk for imbalanced body temperature. For the client diagnosed with hypothyroidism, which intervention should be included in the plan of care? A. Discourage the use of an electric blanket. B. Assess the client's temperature every 2 hours. C. Keep the room temperature cool. Or D. Space activities to promote rest. Risk for imbalanced body temperature. May confusion din dito sa class ko before. So, may I know what your answers are? Okay. Wala. The answer here is letter A. Discourage the use of an electric blanket. Guys, di ba they are cold? So you might think they need electric blanket. Ganun. But this should be discouraged kasi they increase the risk of peripheral vasodilation and increases the risk of vascular collapse. Ang issue talaga dito is the vascular collapse. So ano yung vascular collapse? Yan yung sudden loss of fluid from the blood vessels. So if may sudden loss of fluid from the blood vessels, there is decrease in blood pressure and blood volume. Nag-hypothyroidism na nga eh. Tapos may decreased blood volume and blood pressure pa. So it's gonna worsen the situation. Yung letter B, assess the client's temperature every 2 hours. This is not needed because the temperature will not change quickly. Yung letter C, the room temperature should be kept warm. So it's okay to just keep the room warm, normal blanket, but the use of electric blanket, it's an external heat source na kinda heavy sa body. Vascular collapse, yan yung sudden loss of fluid from the blood vessels. So, magkaka-decrease blood volume and decrease blood pressure. Yung space activities to promote rest, hindi siya applicable sa risk for imbalanced body temp. Number 42. The client diagnosed with hypothyroidism is prescribed the thyroid hormone levothyroxine Synthroid, which assessment data indicate the medication has been effective. A, the client has 3-pound weight gain. B, the client has decreased pulse rate. C, the client's temperature is within normal range. Or D, the client denies any diaphoresis. Synthroid. The answer here is letter C. Tama kayo. The client's temperature is within normal range. Kasi, the client with hypothyroidism will frequently have a cold, like subnormal, below normal temperature. So, if yung temp niya is within normal range na, it indicates the medication is effective. Okay? Yung A, 3-pound weight gain, hindi siya dapat magka-weight gain kasi yung synthroid, it will increase the metabolic rate. Yung letter B naman, same reason sa A, dapat increase pulse rate siya. And then yung letter D naman, this occurs sa hyperthyroidism, not hypo, yung diaphoresis. Number 43. Which nursing intervention should be included in the plan of care for the client diagnosed with hyperthyroidism? A. Increase the amount of fiber in the diet. B. Encourage a low-calorie, low-protein diet. C. Decrease the client's fluid intake to 1,000 ml per day. Or D. Provide 6 small, well-balanced meals a day. And the answer here is letter D. Provide 6 small, well-balanced meals a day. Yung letter A, guys, yung increase the amount of fiber in the diet. This is for hypothyroidism. Kasi the fiber should be increased in the client diagnosed with because of the constipation. Yung letter B, low calorie, low protein. Guys, these people, grabe yung metabolism nila. So, dapat high calorie and high protein diet. Letter C naman, do not decrease. You should actually increase to replace fluids lost through diarrhea and excessive sweating. Yung provide 6 small, well-balanced meals a day, the client will, with hyperthyroidism, they have increased appetite. Therefore, yung well-balanced meals nila, it will help them get through the day with constant hunger. Okay. Guys, I'm just gonna tell you, yung NP1 pala, guys, different vibe siya. Yung NP1, it tests your memorization. Yung NP2, it tests your test-taking strategy, or like what you've learned sa MCN technically. Yung NP5, tests your psych knowledge. Yung 3 and 4, med-surg/analysis. Like, not joking talaga when I say there are things na hindi mo nabasa and then it comes out there. On what topic? This one is for yung mga communicable diseases, ganun. Yung number 44, yeah, CHN. Okay, no problem. 44, the client is admitted to the intensive care department diagnosed with myxedema coma. Which assessment data warrant immediate intervention by the nurse? A. Serum blood glucose level of 74 milligrams per deciliter. B. Pulse oximeter reading of 90%. C. Telemetry reading showing sinus bradycardia. Or D. The client is lethargic and sleeps all the time. Answer here is, ano muna answer dito? Letter B. These are all bad, di ba? But these symptoms are related to myxedema coma. Although they are bad, they are expected. But which is worse here? It's pulse ox reading of 90%. Kasi guys, if the pulse ox reading is 90%, it indicates na of reading of PaO2 of approximately 60, 70, ganun. Di ba yung normal sa PaO2 is 80 to 100? So, yung 90%, around 60 na yan. So, sa arterial blood gas test. So, this is already severe hypoxemia and requires immediate intervention. Marami nag-asa letter D. Letter G is unexpected symptom sa myxedema. So, this doesn't warrant immediate intervention compared sa letter B. Number 45. Which medication order should the nurse question in the client diagnosed with untreated hypothyroidism? A. Thyroid hormones. B. Oxygen. C. Sedatives. Or D. Laxatives. Untreated hypo, untreated low. So, wag natin bigyan ng nakaka-low sa kanya. Do not give sedatives. Okay? Untreated hypothyroidism is characterized by increased susceptibility to sedative effects. So, we should question this one. Yung thyroid hormones, this is the treatment of choice. Yung letter B naman, part sa medical management is aimed at supporting the vital functions like the lungs. So oxygen is okay. Letter D naman, laxatives. The clients with hypothyroidism, they become constipated, di ba? So laxatives should not be questioned. Next is number 46. Which statement by the client makes the nurse suspect the client is experiencing hyperthyroidism? A, I just don't seem to have any appetite anymore. B, I have a bowel movement about every 3 to 4 days. C, my skin is really becoming dry and coarse. Or D, I have noticed all my colors are getting tighter. Hyperthyroidism. Anong answer niyo dito, guys? Answer is letter D. Marami ding nagkakamali kasi I have a bowel movement. Yung letter B, guys, I have a bowel movement about every 3 to 4 days. Not hours. Days. Okay, so constipation na to. Yung letter D naman, the thyroid gland sa neck, it enlarges. It results as a result of increased thyroid hormones. So, yung enlarged gland, tawag niyan goiter. Next is number 47. The 68-year-old client diagnosed with hyperthyroidism is being treated with radioactive iodine therapy. Which intervention should the nurse discuss with the client? A, explain it will take up to a month for symptoms of hyperthyroidism to subside. B, teach the iodine therapy will have to be tapered slowly over 1 week. C, discuss the client will have to be hospitalized during the radioactive therapy. Or D, inform the client after therapy the client will not have to take any medication. Answer here is letter A. Explain that it will take up to a month for symptoms of hyperthyroidism to subside. Guys, yung radioactive iodine therapy, ginagamit to destroy the overactive thyroid cells. And then after treatment, 1 dose lang yan. After treatment, the client is followed closely for 3 to 4 weeks until the euthyroid or the normal thyroid state is reached. Well, taper slowly, no need to taper slowly kasi 1 dose lang naman siya. Letter C, discuss the client will have to be hospitalized during the radioactive therapy. No, this is, the client may have to stay up to 2 hours only after the treatment. And then letter D, inform the client after therapy the client will not have to take any medication. Baka it's a prank siya, guys, kasi if too much of the thyroid gland is destroyed by this therapy, the client may develop hypothyroidism and may have to take thyroid hormone for the rest of his or her life. So, baka sasabihin niya, sabi mo, hindi na ako magta-take ng medication. So, ganun. For lifetime na if may hypothyroidism. Number 48, the patient is admitted with thyroid storm, which signs and symptoms are not present with this condition. Select all that apply. A, temperature of 104.9. B, heart rate of 125 beats per minute. C, respirations of 42. D, heart rate of 20 beats per minute. E, intolerance to cold. Or F, restless. Break po muna. Answer here is D and E. D and E. Heart rate of 20 beats per minute. Taas na rin, guys, yung 104.9 Fahrenheit. Yung heart rate din of 125, mataas. 42 are mataas and restless. Also a high symptom. So, only the heart rate of 20 beats per minute and intolerance to cold is not related to thyroid storm. Number 49. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? So, hanap ulit tayo ng mali. A, the thyroid hormone to the client who does not have a T3, T4 level. B, the regular insulin to the client with a blood glucose level of 210 milligrams per deciliter. C, the loop diuretic to the client with a potassium level of 3.3. Or D, the cardiac glycoside to the client who has a digoxin level of 1.4 milligrams per deciliter. And the answer here is letter C. Very good. Kasi yung normal level ng potassium is 3.525. Tapos, dito, 3.3. And then, bibigyan pa ng potassium wasting na diuretic. So, you should question this one. Yung letter A, thyroid hormone, they should be given who doesn't have T3, T4 level. Letter B naman, 210 milligrams per deciliter, dapat bibigyan na yan ng insulin. And then yung letter D, digoxin level is, yung therapeutic range ng digoxin is, as I remember, it's 0.822. That's what I use. Therefore, the nurse should administer the medication. Oh, hypokalemia malala. True. Last, finally, number 50. Which signs and symptoms should make the nurse suspect the client is experiencing a thyroid storm? Break po. A, obstipation and hypoactive bowel sounds. B, hyperpyrexia and extreme tachycardia. C, hypotension and bradycardia. Or D, decreased respirations and hypoxia. Answer here is letter B, hyperpyrexia and extreme tachycardia. Hyperpyrexia and heart rate above 130 beats per minute are signs of thyroid storm, a severely exaggerated hyperthyroidism. Yung obstipation, guys, that is extreme constipation. Letter C naman, decreased blood pressure, low. D, also low. So, I guess that's all for tonight. Tomorrow, guys, may class ba kayo tomorrow? Before, icons. Okay. So, hanggang 5 p.m. yung icons, diba? Or 12 lang? Hanggang 4. Okay. Mag-exam. Okay. Thank you so much for listening, and I'll see you tomorrow for NP1 and NP2. Thank you.
Thank you po, ma'am.
Thank you.